Have you ever gotten so upset at your doctor because of something they said that you just got up and just walked out? Well, if that's happened to you, you're going to want to listen to this because that's exactly what happened to one of my patients just a week ago. So last week, my office phone rang. It was a former patient calling from the parking lot of another orthopedic clinic, and she was visibly, audibly upset. She had just walked out on the surgeon. Why? Because he looked at her MRI. First of all, I came walking in looking at the MRI, not at her, and said, "You need surgery. Let's get it scheduled right now." When she asked, "Well, what if I don't want it?" he told her she wasn't listening. But the truth is, he wasn't listening to her. Today, on Defeating Pain, or breaking down why a scary MRI report doesn't always mean you're headed for the operating room, and how we're going to try to save this patient's shoulder without a single stitch. So I'm calling this the case of the dog versus the shoulder. Here's the story. Back in October, the patient was walking her dog. The dog saw something and bolted and yanked her right arm. Hey, happens, right? Any dog owner would tell you. It's happened to me. But she did the right thing. She went to the walk-in, got an x-ray, no fractures, but they did order an MRI. Now, this is where it gets kind of weird because the system's pretty slow. The MRI was not scheduled till December. Think about that. 2 months of being in pain, wondering what's going on with the shoulder before she can even find out what her options are. Then she goes in. He doesn't even talk to her. He's looking at the MRI and says, "You got to have shoulder surgery." That's not good. So what did the MRI actually show? Torn supraspinatus, part of the rotator cuff, torn infraspinatus, part of the rotator cuff, a labral tear, the cartilage that surrounds the socket in the shoulder joint. Hey, on paper, that's a surgical shoulder all day long. But, as I always say, we don't treat paper, we treat people. She's not getting ready for spring training with the Tigers. So when she came into the exam room, she was frustrated. She was very frustrated by that encounter. So I had to do something different than what he did. Well, first of all, I did an exam. I did a range of motion on her shoulder, and I did some muscle strength testing. It was all abnormal. All right, it all pointed to the rotator cuff. And I said, "Hey, what can't you do? What's the functional limitations?" He didn't ask this. She said, "I just can't put my jacket on. That's when it hurts." So she's not trying to win a CrossFit competition. She just wants to get dressed without a wince of pain. So if your only limitation is a jacket, should we really subject you to 6 months of grueling post-op rehab, the risk of anesthesia, and the trauma of surgery? Maybe, but shouldn't we try everything else first? That's kind of smart, wouldn't it? So why listen as a clinical tool? See, the surgeon told her, "You're not listening to me." But in my office, the patient is the expert on their pain, and I'm the expert on options. If a patient says, "I don't want surgery," that is a clinical data point to me, just as important as the size of the tear. So you know what? We decided right then and there, we're going to try conservative route. We're going to work on the functional movement with targeted neurological rehab. Will we be 100% successful? I don't know yet, but I do know that she left my office feeling empowered instead of bullied. So the lesson for you today is this. An MRI is just a snapshot in time. It doesn't show your resilience, your pain tolerance, or your body's ability to compensate. If you feel like your doctor is talking at you instead of to you, do like she did and find a new parking lot. I'm Dr. Ted Arkfeld, and if you've ever felt pressured into a procedure, tell me your story in the comments. Let's talk about it. And don't forget, hit the subscribe so we can keep defeating pain together.